Croakey Go here at VACCHO in Collingwood in Melbourne. We're talking Vic Votes today, and we're starting off here at VACCHO, the Victorian Aboriginal Community Controlled Health Organisation, and we'll be wandering around Collingwood and Fitzroy with co-health and stopping at lots of different interesting stops on the way. And with me I have Jessie, who is in our Koorie Maternity Service team, and Mel, who is our expert on ice. And they're both going to have a quick chat about what they do. So, Jessie, can you please tell us a bit about what you do?
Sure. Thank you. I'm the project officer for the Koorie Maternity Strategy here at VACCHO, and I describe my role as to listen well and respond appropriately to the Koorie Maternity Services workforce, which are right across Victoria, that provide their service to Aboriginal communities and across 14 sites, 11 are Aboriginal community controlled and 3 in mainstream hospitals. The workforce consists of Aboriginal health workers, practitioners and midwives, and non-Aboriginal midwives as well, and the importance of providing culturally safe and appropriate maternity care for Aboriginal women and women birthing Aboriginal babies and their families.
And Mel, can you tell us about your role, please?
So my name's Mel Rehana. I'm the coordinator for the Aboriginal Metropolitan Ice Partnership. It's a collaboration between mainstream orgs and ECHOs. So it's to create a culturally safe environment for people, community, so that they can get the right treatment and a culturally safe journey through their way to recovery. So I support both the workers of mainstream as well as the workers at ECHOs.
What are some of the most important features of that?
So the most important feature is for better health outcomes across the board, we need to all walk together. Some of our ECHOs don't have appropriate funding, and working with a mainstream organisation, they've got access to other facilities, which helps especially our country, Victoria. They need the help, they need the assistance, and that's where the funding comes in. Thank you.
How many workers do you have within community in Victoria?
So we've just started doing an advertising campaign because we're looking at boosting the numbers of Aboriginal and Torres Strait Islander workers across our lovely state. So as this comes along, we're trying to push and get more people interested in careers, not just in AOD but also in mental health, because we need more and more support. Thank you.
And what are some of the features of the Koorie Maternity Services? What are some of the programs that they offer for women?
Yeah, so women can come into the Koorie Maternity Service program and connect with the workforce at any time that suits them. And the maternity service completes at around 6 weeks post-birth. It's really, really important. Koorie Maternity Service provide flexible and continuity of care through a woman and family's maternity journey, and in that way best meet the individualised needs of every Aboriginal family in Victoria.
And Mel, what would you like to see as a result of the current state election?
Oh, sorry. Please remember, we need support not only from community level but from government level, so increased funding would be a great help, especially across all our programs, because all our programs are important and this is a journey that we all have to make together. Thank you.
And Jessie, any words from you on that?
I would say that for Koorie Maternity Service, cultural care is at the centre of culturally safe and appropriate maternity care, so that cultural safety and clinical safety walk alongside that woman and her family through their maternity journey. And in that way I would advocate continual change towards us as a whole society of non-Aboriginal people becoming more embedded in our cultural safety and competency skills, and in that way Aboriginal health is everyone's business.
Thanks, Jessie and Mel, that was great.